How to increase effectiveness of massage session combining two different massage techniques in one application. My name is Dr. Turchaninov and I am founder of Science of Massage Institute located in Phoenix, Arizona. In this short video, I'll show you a clinical application of friction kneading, which combines two different techniques in one and uses two different applications. Why you need these techniques to start with? Because in the same amount of time, you can provide much more efficient therapy by combining two completely different approaches. And this techniques effective on the large muscle group. I'll show you application on the patient back as well on the posterior thigh, that you can see different areas which can be used when this technique can be used. Friction kneading has a long history of clinical application and belongs to the library of Western medical massage techniques. The idea of using this on the patient allows therapists at the same time decompress tension in the skin, in superficial fascia, as well as in the superficial skeletal muscles. From that point of view, in one technique application, you allow to stimulate different receptors located in different layers of the soft tissue, and that's the beauty of application. Friction kneading can be part of regular massage session when you use that as a stress reduction or preventive role of massage therapy. But it can also use as a structural component of medical massage rehabilitation when therapists target large muscle groups as well as fascia to decompress before using specific tools, for example, trigger point therapy, muscle energy technique. In such case, friction kneading saves time, gives much more clinical outcome, and prepare tissue for more sophisticated application. Now I'll show you how to use friction technique in slow motion and in the clinical application, that you get all components, because generally speaking, this technique have a lot of elements to execute it correctly, including correct body mechanics. If you want to decisively help patients in complex clinical cases, greatly increase your income, and partner with local medical communities, please click right now at the link below in description and join us for live medical massage seminars and webinars, and we will work together. Thank you and see you in the future. I will use patients with the middle back pain, and I will apply it on the left side that you can follow clinical application. So here is left paravertebral muscles, and I will apply friction kneading from the lumbar spine all the way to the middle back. And I would like you to pay attention to elements of it. First, placement of the hand. If I will place my hand here, then you will see that the fold of skin form in front of my hand, which is on the ulnar edge. Now then, I put soft fist on the paravertebrals, and my soft fist will do that. You see, I'm staying on the paravertebrals without hitting the bone. For that to happen, you need to lean against the table to free your lower back, and the vertical pressure comes from the shoulder and from the upper body. Now, the fist will give you kneading from right to left of the paravertebrals. The hand which goes in front of the fist will push skin forward and then create fold of skin, which will push and create a friction component of the application. In such case, you have kneading with the fist and the friction with the other hand. Another critical aspect, that this hand guards the fist, because if you do it only with the fist, there is chance you can slip and injure your fist. From that perspective, the guard, which is your left hand, don't let that happen. So here is slow application of the friction knee. You have contact and you are not doing them together. Fist rotated within the left hand. Here is the kneading. Now stabilization, and I'm doing that within the left hand. And now two hands move as one, doing two different things. So here is the clinical application. and you can see clearly that the fold of skin travels in front of my left hand while my right hand produces kneading, and I am transferring my body along the table. Again, here is clinical application. And I am staying only on the muscle mass. It's very soft, but you need to have a guard. And the critical is position of the arm, because the vertical pressure comes from the upper body. Here is the application of friction kneading on the posterior thigh, when you have again large muscle mass, which allows you to create this swivel movement of the tissue under practitioner hand. So here is again soft application of the wrist, which is create kneading component, and the hand stabilizes the tissue and move fold of skin in front of the fist. So here is application of the friction kneading on the posterior thigh. Friction kneading is a structural component of the stress reduction, sports massage, or medical massage session. It can be applied in any scenario, but it is preparation for much more sophisticated application, or it's part of the stress reduction session when you actually able to decompress soft tissue, challenge peripheral receptors, reset balance within both division of autonomic nervous system, and reduce stress in patient. It has this value as that within same amount of time, therapist able to combine two techniques together to challenge receptors in the different levels of the soft tissue and address two different levels of the soft tissue at the same time, which is skin, superficial fascia, and superficial skeletal muscle affected at the same time in one application. From that perspective, it's very helpful additional tool which you can employ to help build successful clinical or preventive massage practice. If you have questions, you can leave your comment below, and we can have productive intellectual discussion which help you and your patients, clients, and we will get feedback from you with all your opinions and suggestions. Thank you for watching, and let's build your practice together in the medical massage application. I see you next time. Bye.